Many times, stomach aches, back pains, indigestion, weight loss, and tiredness go unnoticed, but they can be signs of pancreatic cancer. According to experts, 1 in every 3 adults with pancreatic cancer ignore these signals. The pancreas acts in the digestive system and is responsible for the production of enzymes, fundamental for digestion and insulin production. Most cases of pancreatic cancer do not show any symptoms in the beginning. In the cases where it does show some symptoms, they are very light, which can make it harder to identify. However, when they are intense, it usually means that the cancer is already in an advanced stage, which hinders the treatment. Get to know the 7 symptoms now. Jaundice. A very common symptom is a yellowing of the eyes and skin. It happens because of a buildup of bilirubin, a dark yellow substance produced by the liver. The liver releases bile, a liquid which contains bilirubin. But when the common bile duct gets blocked, bile can't reach the intestine and it causes a buildup of bilirubin in the body. Weight loss and appetite loss. Losing weight is a common sign of cancer because people who suffer from this disease usually have little to no appetite. Back or abdomen pains. It can happen because the tumor on the pancreas can grow and press against the nearby organs, causing pain. Is this video being helpful? Give it a thumbs up to help spread this important information to other people. Vomiting and nausea. As the cancer presses the opposite end of the stomach, it can partially block the organ. It makes it harder for the foods to pass through it, which then causes nausea and vomiting. Dark urine. Sometimes the first sign of jaundice is a darkening of urine because of bilirubin. When the bilirubin levels in blood increase, urine becomes brown. Light-colored or oily feces. If the bile duct is obstructed, feces can show a light or grayish color and have an oily aspect. Itching. When bilirubin gets built up on skin, it can turn yellow as we have seen before and also causes itching. Blood clots. Did you know that a clot in your legs can be a sign of pancreatic cancer? Pain, swelling, redness, and warmth in the legs can be a signal of a blood clot. However, having a blood clot usually doesn't mean you have cancer. Most blood clots are caused by other reasons, so don't worry. Do you have any of these symptoms or know someone who has? Having 1 or more of these symptoms doesn't necessarily mean you have pancreatic cancer. Many of the symptoms can be caused by other medical conditions. But if you have any of them, it is important to visit a doctor to get a diagnosis and, if necessary, start treatment. If you liked the video, give it a thumbs up and share it with your friends. For more recipes and tips, subscribe to the channel.